Are you looking for relief from neuropathic pain? If so, you have probably come across the medications Gabapentin and Pregabalin. Both drugs are commonly prescribed for the treatment of neuropathic pain, but what are the differences between the two? In this video, we will compare Gabapentin and Pregabalin to help you make an informed decision about which medication may be right for you. What is Gabapentin? Gabapentin is an anticonvulsant medication that is primarily used to treat seizures and nerve pain. It was first approved by the U.S. Food and Drug Administration, FDA, in 1993 for the treatment of epilepsy. Since then, it has also been prescribed off-label for neuropathic pain conditions such as diabetic neuropathy and postherpetic neuralgia. Gabapentin works by reducing the abnormal excitement in the brain that can cause pain. It does this by binding to a specific type of calcium channel in the brain, which helps to regulate the release of certain neurotransmitters involved in pain signaling. By modulating the activity of these neurotransmitters, gabapentin can help alleviate neuropathic pain. What is pregabalin? Pregabalin, like gabapentin, is an anticonvulsant medication used to treat neuropathic pain. It was approved by the FDA in 2004 for the treatment of diabetic neuropathy, postherpetic neuralgia, and fibromyalgia. Pregabalin is also prescribed off-label for other types of neuropathic pain. Similar to gabapentin, pregabalin works by binding to calcium channels in the brain, but it has a higher affinity for a specific subtype of these channels called the alpha-2 delta subunit. By binding to the alpha-2 delta subunit, pregabalin reduces the release of certain neurotransmitters, thereby reducing pain signals in the brain. Similarities between gabapentin and pregabalin. Gabapentin and pregabalin share several similarities, which is why they are often compared to each other. Both medications belong to the same class of drugs called anticonvulsants and are approved for the treatment of neuropathic pain. They work by modulating the release of neurotransmitters in the brain, ultimately reducing pain signals. In terms of efficacy, gabapentin and pregabalin have been shown to be effective in treating various neuropathic pain conditions. Studies have demonstrated their ability to provide relief from pain and improve overall quality of life in patients with conditions such as diabetic neuropathy, postherpetic neuralgia, and fibromyalgia. Both medications also have a similar side effect profile, with the most common side effects being dizziness, drowsiness, and peripheral edema. These side effects are generally mild to moderate and tend to improve over time or with dosage adjustments. However, it is important to note that individual responses to medications can vary, and some individuals may experience different side effects or have a higher risk of certain adverse events. Differences between gabapentin and pregabalin. While gabapentin and pregabalin have many similarities, there are some notable differences between the two medications. One key difference is their pharmacokinetic properties. Gabapentin is absorbed relatively slowly and has a shorter half-life compared to pregabalin. This means that gabapentin needs to be taken multiple times throughout the day to maintain therapeutic levels in the body, while pregabalin can be taken fewer times per day. Another difference between gabapentin and pregabalin is their dosing. Gabapentin is typically started at a low dose and gradually increased over time to achieve the desired therapeutic effect. On the other hand, pregabalin has a more predictable dose-response relationship, allowing for a fixed dosing regimen from the start. Cost is another factor to consider when comparing gabapentin and pregabalin. Generic gabapentin is generally more affordable than brand-name pregabalin, making it a more cost-effective option for some individuals. However, the availability and cost of medications can vary depending on the country and healthcare system. Effectiveness in treating neuropathic pain. Both gabapentin and pregabalin have been shown to be effective in treating neuropathic pain. However, individual responses to these medications can vary, and what works for one person may not work as well for another. It is important to work closely with your healthcare provider to determine the most appropriate medication and dosage for your specific condition. Several clinical trials have compared the efficacy of gabapentin and pregabalin in various neuropathic pain conditions. A meta-analysis published in the Journal of Pain Research found that both medications were effective in reducing pain intensity and improving quality of life in patients with diabetic neuropathy and postherpetic neuralgia. However, pregabalin was found to be more effective than gabapentin in terms of pain relief. In another study published in the journal Pain, researchers compared the efficacy and safety of gabapentin and pregabalin in patients with fibromyalgia. The study found that both medications were effective in reducing pain and improving sleep quality, but pregabalin was associated with greater improvements in pain relief compared to gabapentin. Side effects and safety considerations. When it comes to side effects, gabapentin and pregabalin share many similarities. The most common side effects include dizziness, drowsiness, and peripheral edema. These side effects are generally mild to moderate and tend to improve over time or with dosage adjustments. However, there are some differences in the side effect profiles of gabapentin and pregabalin. For example, pregabalin has been associated with a higher incidence of weight gain compared to gabapentin. It is important to monitor your weight regularly and discuss any significant changes with your healthcare provider. Both medications can also cause potential risks and adverse events. For example, gabapentin and pregabalin may increase the risk of suicidal thoughts or behavior, particularly in individuals with a history of depression or other mental health conditions. It is important to be aware of these risks and seek immediate medical attention if you experience any changes in mood or behavior. Dosage and administration guidelines. Gabapentin and pregabalin have different dosing and administration guidelines. Gabapentin is typically started at a low dose and gradually increased over time to achieve the desired therapeutic effect. The dosing regimen for gabapentin can be complex, with multiple doses taken throughout the day. It is important to follow your healthcare provider's instructions regarding the dosing schedule. Pregabalin, on the other hand, has a more predictable dose-response relationship and can be started at a fixed dose from the beginning. The dosing regimen for pregabalin is generally simpler, with fewer doses required per day compared to gabapentin. It is important to take these medications as prescribed and not to adjust the dosage without consulting your healthcare provider. Abruptly stopping gabapentin or pregabalin can cause withdrawal symptoms or a rebound increase in pain. Which medication is right for you? The decision of whether to choose gabapentin or pregabalin for the treatment of neuropathic pain should be made in consultation with your healthcare provider. Factors such as the specific condition being treated, individual response to the medication, side effect profile, dosing convenience, and cost should all be taken into consideration. If you have a history of kidney problems, it is important to discuss this with your healthcare provider, as both gabapentin and pregabalin are primarily eliminated from the body through the kidneys. Dose adjustments may be necessary to ensure the medications are safe and effective for you. Ultimately, the goal is to find the medication that provides the greatest relief from neuropathic pain with the fewest side effects. It may take some time and trial and error to determine the most appropriate medication and dosage for your specific situation. Conclusion and final thoughts. Gabapentin and pregabalin are both effective medications for the treatment of neuropathic pain. They work by reducing abnormal excitement in the brain that can cause pain. While they have similar mechanisms of action, there are some differences to consider when choosing between the two medications. Factors such as side effects, dosing schedules, and cost can play a significant role in determining which medication is more suitable for you. It is important to work closely with your healthcare provider to find the best treatment option for your neuropathic pain. By understanding the differences between gabapentin and pregabalin, you can make an informed decision about which medication may be right for you. Remember to discuss any concerns or questions with your healthcare provider, as they are best equipped to guide you in choosing the most appropriate treatment option for your specific condition.